We are hard hit as the health sector because the biggest loser in this cash crunch is actually health, because health does not have seasons. Our people can get in sick anytime. Health is a requirement all the time, and therefore, just like you can never find a closed police station. We never close our hospitals. We are always open, and if we close them, our people will go somewhere else, and we do not want them to go somewhere else, because somewhere else means they have to start seeking alternative form of treatment, which could be traditional, mitishamba or maombi. Therefore, we are hard hit because we are all seasons, and we require the resources to buy drugs. We require resources to pay health workers. We require resources to buy commodities that are non-pharmaceuticals, and therefore, and also run the programs. So when around this time, when we have a cash crunch because of fighting, we have interest that fights for the same resource, including the debt obligation for the national government to pay debts that were incurred to our lenders. And also we have other programs that are also waiting to be implemented at the national level. It is important that we prioritize the counties, and especially because of the health facilities, because that is where the rubber meets the road for everybody. Anybody can get sick, and you can be anywhere when you get sick. Today the president could be in Mombasa and they require medical attention. The nearest hospital may be Mombasa Referral Hospital. So we need to make sure that they are functioning. At the moment, counties, we are on our knees, because we are not only missing money to pay salaries for health workers, we are also missing money to buy commodities and also be able to support systems that support health. And therefore, it is our request to the Treasury to prioritize. After they have hit their debt obligation, the first charge should not be Parliament, it should not be National Assembly, it should not be Senate, it should not be the ministries at the headquarters. It should be the health sector at the village. And that is why, as counties, we are looking for ways of separating the money that goes to other facilities from what usually is collected and taken back to CRF to be utilized in any way. And we have asked our counties to ring-fence the funds that are collected, or revenue that is realized from health facilities, in an arrangement we are calling Facility Improvement Fund, which we have told all the counties to regularize through regulations that allows that all money collected from those facilities finds its way back to those facilities, to ensure that we don't go borrowing from the national government or from any other source for us to be able to maintain those facilities. Well, I would not, the government is usually perpetual. And I know that the treasury that is in place at the moment must have inherited a big debt burden that was incurred by the previous regime. The question is, now that they know where the problem is, shall we be having this problem even 2 years down the line? Or what is the priorities to ensure that we as we pay the debts, we can also ensure that we don't let the systems collapse? Because you can pay debts, and at the end of paying debts, you realize you have no Kenya because all systems have collapsed. We must ensure that even when we are starving the departments, we do not completely starve them to the extent that they die. Let us just maybe go on diet, but not the kind of a diet that allows the systems to die.
And are we probably foreseeing workers in the health sector downing their tools as a result of this?
Well, that is a very contentious issue, because we don't encourage that. At the end of the day, even the health workers are part of our Kenyan population. They are part of the country that we call Kenya. We require patriotism and them to have an understanding what is happening, because if they see it's something of our own creation, that would be different. But now we are aware that the debt obligation, which should be made public, because that is where the problem is. When people have no information, sometimes they misinterpret it. In fact, it is very critical that Treasury makes it open or known to the Kenyans what are our debt obligations, and why we have the cash crunch we have at the moment. Because I have been around in devolution for the last 6 years. I served the first 5 years and doing second term. I have never seen a situation where we get to a fourth month without having disbursement of funds to the counties. The most we could go was maybe 2.5, But 4 months, that has never been heard of. And, I'm talking about the government that I supported. The government, even today, I was elected on a UDA ticket, Kenya Kwanza, and I understand where we're in, and we cannot blame our government. But the people have been given that responsibility. Please let us put our priorities right so that we do not crash our systems even as we plan. I know there are competing interests for these same resources, but let us just say that this one is the youngest child in this house, and therefore the elder one can wait as the young one is given nutrition so that they don't die of malnutrition, and that is health. Last time I spoke to the Cabinet Secretary for Treasury, Professor Ndungu, he'll put it on the table. He can only work with what he has. He relies on KRA to bring funds to the Treasury so that he can be able to pay. When he does not get enough funds, then there's nothing to disband. And when you talk to KRA, they tell you that it is the same people who are malnourished who are supposed to be paying taxes for us to be able to recycle these taxes. So it is a vicious cycle, and it's something that needs better planning. It's something that needs to be treated as a crisis by government, be discussed, and solutions must be come up with. Well, I'm happy that with the mandamana out of the way, now we can be able to focus on a bit of planning. Yeah.
So, but there's no some sort of people within the.
I would not say it's really sabotage. I think you're just competing interests, because everybody wants their department to be resourced. Without realizing that sometimes their department may not be the priority for the whole of Kenya. There are others that really are on their knees and need the priority ahead of them. We need to be a little bit magnanimous to make sure that we release resources to support those who are in extreme need, even as we wait for the resources to be available for the whole country.
Asante.
Thank you very much.
Asante.